In today's edition of Docplexus KOL Interviews, we have with us Dr. Rajeev Ranjan, who is the Secretary of the Resident Doctors Association at All India Institute of Medical Science. He did his MBBS from the Government TD Medical College, Alleppey, Kerala in 2009. He completed his residency at the Department of Lab Medicine, AIIMS. He was also associated with the Department of Cardiac Anesthesia in Medanta-the Medicity Hospital for 3 years. Thank you, sir, for joining us.
Thank you very much.
So, what's the importance of lab medicine in Indian healthcare system?
Look, lab medicine is one of the most emerging department, as you can say. But this concept has not been much franchised in India because it's a very new, and it started around 20 years ago in All India Institute of Medical Sciences by my professor HOD A.K. Mukhopadhyay. So, outside India, there is no such diagnostic departments. Like in India, you can see pathology, microbiology and biochemistry and all, but all this amalgamated, this department is amalgamation of all these departments. And outside India, the concept is about lab medicine. So, you have a single window, like if you want any diagnostic, if you have to go for any diagnostic purpose, you will go to the lab medicine. But in India, the concept is entirely different. Like it's like a very cumbersome process for, like, if you have any pathological related work, you have to run to the pathology department. If you have any serological, you have to run to the other department. If you have any biochemistry tests, you have to run to the biochemistry. So it creates a sense of havoc among the patient, like where I have to go. So this novel concept is a very good thing, and we should appreciate it and we should accept it in the Indian culture. Because nowadays, when you see that if a patient's budget, like what you say, when you go to the corporate hospital, it's not much in the government setup, because you don't have to pay at government setup. But in corporate hospitals, when you go through the bills of a patient, you will find that almost 55 to 65% bill is generated from the laboratory side. So we need to tap on this thing, and we need to produce human resources for that thing, because till now what the thing was going on in practice in India is that laboratory is being neglected, and there are very few experts working in the laboratory medicine side, and all the tests and reports are being signed and being worked upon by the technicians. And in some rural areas and in tier 2 cities and 3 cities, you will find that any who also will be opening a laboratory department and laboratory things, and they will be doing the tests. So this it's a request to the government and the administration who are working on the formulating the health policies and all, they should regulate this department. They should come up with the idea which was generated in the All India Institute of Medical Sciences, because if All India Institute of Medical Sciences does anything, it means they are looking for a better thing and for the on the international standards. So they should respect this decision, and they should start the laboratory medicine department across India in all the medical colleges, so that we could generate a lot of new human resources.
So, can you tell us what exactly are the challenges that are there currently in order to create new departments for diagnostics, family medicine, etc.?
Very apt question. We have been fighting for this thing from post to pillar. Like, we had several representations to the NCI, but I don't know, they are every time they are there might be some lobbying or something like that. So they are rejecting the things, because any new departments when comes up in AIIMS or anywhere in India, we have a proper committee for that thing, administrative committee and educational committee and all. They only decides and say over which department should come in. But AIIMS has already proven this thing, and we have a full-fledged running department. We have already produced around 30-35 laboratory physicians in India through AIIMS. And now upcoming a lot of like CM Civil Law and JIPMER and Safdarjung across the road, and many of the corporate hospitals where you go, we have a department named as laboratory medicine. But this department has not been started in another medical college, because there is one, that lobbying factor. Second is that the government is not at all interested, and they are totally unaware of the things that something this could come up and they could benefit the person in people. So we need to put a very strong representation to the government and to the health policy makers, you should come up with like consolidated departments like lab medicine. When this there is some sort of like insecurities among the other specialities also, like pathologist. My friends are sitting here. I mean, pathologist like and biochemistry people and microbiologists, that once this department comes, their thing will go out. But no, we can nurture and we can work together. Like everybody has a say in medicine, like medicine, surgery, they're all, it's a holistic department. Like we can work together and we have to work together. So it's a request from everybody that they should think about this department, because for any diagnosis for any diagnosis of a disease, laboratory is a very main part. So we should consider this department.
Right. Also, the government has now mandated that any lab report, diagnostic report would now be signed by a doctor and not a technician. What are your views on that?
Yeah, my views on that is that it's a very this decision should have been taken very long, but no problem, like late, and they have come with a very apt decision. But the thing is that there has been hue and cry from technician bodies and other things, and they had also made their representation recently in AIIMS. Also there was a directorial level meeting over this thing, the diagnostic reports which doesn't need any interpretation can be can be given through with the technicians and all, but a diagnostic process and tests which need a proper interpretation should be only signed by the doctors, because they only know the pathology, they only know what are the next level diagnosis we can do, and they understand the medical terms properly. So it should be done by them only. Late but not government and the Supreme Court, we really appreciate this thing, this judgment.
Indian government hospitals lack administrators, hospital administrators. Do you think having them would improve the situation?
Definitely. As you mentioned before that I have a work experience in corporate hospitals to the caliber of Medanta. So Medanta is such a huge hospital, and it is renowned across the world because it's being run by Dr. Trehan. He's himself has spent a lot of his time outside India. So a hospital administrator has got a lot of responsibilities, and they know the hooks and crooks and the small nitty gritty things, what makes running a hospital, what is hampering in running a proper functioning of an hospital. So we should generate these human resource also. As I said, along with the laboratory physicians, hospital administrators should also be generated. And for this thing, there are only certain government hospitals in India who generate, who have a degree like MD hospital administrators. One is AIIMS also, and PGI, they are the best. So I would request to the government and the health policy makers that they should come up with this idea, because each and every hospital need a hospital administrators. Nowadays, this hospital administration work is being carried out by senior doctors. So in that way, we are not taking his expertise which he was expertised in, and we ask him to do the administrative work. So in the one or other ways like that, we are not utilizing his proper expertise, and we ask him to do a work which he is not expertised into. So that will definitely create some problems. So we need to generate this department, and this will be a very good for the Indian health system.
Yes, and also we'd like to talk to you about the scarcity of doctors in rural areas. Do you think equal pay is going to solve that problem?
Hopefully. Because every now and then when we put a representation to the government, and very recently there was a hue and cry over the NMC bill, National Medical Commission bill, and the government has put one thing that they are going to start a bridge course to nick that gap between the doctors in the rural areas. So they want that AIUS doctors should come and they should fill the gap. They will be getting, they had proposed to put them on a 6 months this training process. After that, they will be getting a license to practice in the rural areas. But I think government is making a very big problem, going to create a very big problem, because once they'll get a license, because nobody can study medicine in 6 months. We spend our 5.5 years studying MBBS. After that, we do a 3 years of post graduation. After that, we do a 3 years of super speciality. So how could any person can get the nitty gritty of medicine in 6 months? And it means that you are creating someone with like a lack of knowledge and all, and you are exposing them into the rural areas, which is most vulnerable area. I mean, people over there doesn't they are not totally literate, and they doesn't know what the nitty gritty of the things, and they are the things persons who come to the peripheral hospitals like AIIMS. So definitely if you put the Indian doctors like MBBS doctors into that place, and why Indian doctors doesn't go to that place is that ki after studying 5.5 years, when you ask them to work for a mere 20,000 or 15,000 or 25,000, I mean, it's totally unacceptable, because nowadays you see that plumbers or electricians or mason workers, they are also earning around 1,000 rupees per day. So what is the use of studying for 5.5 years? And that is the reason that people are getting disheartened, and they don't want to work in the rural areas. One more thing is that even though money is not a big thing, I mean, they can have it because when you come to medicine, you have a passion of working for people and working for the medicine. But the thing is that how you will work in a place where you don't have a proper infrastructure. Like I have my anesthetist friend here, he will explain why, I mean, when a people come to you needing ventilators or any sort of surgical things, if you go to a hospital where you don't have even a proper bed, how will you do it? In that way, people get aggressive who come with their relatives, they are emotional at that time, and in retaliation they start violence with the doctors, that doctors is not equipped, he doesn't want to help the people, he doesn't want to serve the people, and in that manner we are getting assaulted by the relatives. So this has a connection with the violence against the doctors. So it's a request to the government and the health policy makers that you should make a standard payroll and remuneration for the medical fraternity, so that everybody should come forward and work in the rural areas.
Agree. Do you also think that community networks like Docplexus help doctors voice their concerns?
Yeah, it's a generation of media, and earlier there were very few channels to express your views. Like if it would not have been possible to express my views if Docplexus thing has not been there. So I really appreciate your hard work and your thing into that. You people have a thought and a vision for the medicine, that you are going here and there and collecting facts and the discrepancies what the health system in India right now facing. So I am really thankful to Docplexus, and you should come up with more such ideas, and you should explore your wings to all of the India.
Thank you so much,
Thank
Dr.
you very
Ranjan.
much.